Welcome and thank you for joining us. We're going to give folks just a couple seconds to trickle in here and then we'll get started. All right, well, it looks like we've got a quorum. Good afternoon, everyone, and welcome. My name is Guido Margolin. I'm going to be your MC and facilitator for today's conversation. Really grateful that you're joining us. We're really excited to have two of my friends and colleagues, Marla Weston and Carissa Bamford, join us to discuss what is probably one of the most important topics as we think about healthcare today, is how do we care for those who care for our communities. Before we dive into the main event, of course, just some housekeeping to go over. All of you all are going to be muted. We do have a couple polls. We'd really love to capture your perspective as we think about the conversation. Just so you know, responses will be anonymous. We will share with you all the feedback from the group and some of our follow-up activities. We do have a chat feature. We'll ask you guys to really be participating. We've got a couple questions and curiosities, and I think our goal is to really infuse your voice and perspective into today's conversation. And so we're hoping that as we go through today's conversation, you all jot down questions that you'd like us to pose to the group so we can all address them together. At the bottom of your screen here, I'm not sure if this is your first Zoom meeting or not, but we do want to just make sure you're comfortable with navigation. The first is the audio. Again, you all are muted right now. You'll notice the chat function. To add into the chat, all you got to do is click on that and you'll be able to respond back to the audience. There's a QA function as well. And what that enables us to do is actually catalog all of your questions and make sure that we answer them. If we don't get to all of them today, in our follow-up, we'll draft responses for you, okay? So that being said, you've just gotten the tutorial. We want you guys to dive right in. Today's conversation is really about well-being and how do we care for those who are caring for our communities. You know, when you think about well-being for your employees, would love for you to jump in the chat and just type in one or two words that come to mind. There's no right answer here. What are the first one or two words that come to mind? I see a lot of people raising their hands. Chat is disabled. Uh-oh, okay. I've got a better option for us on the fly here is why we put it into the QA, because I know we can see that in there. I've got holistic and meaningful from Carissa, health from Craig, essential from Teresa, resilience, empathy, work-life balance, love that, Julissa, persistence, balance, work-life balance, a lot of balance I'm seeing, lacking, self, team and organizational culture are all part of it. Awesome. Really important pieces of information that I think you'll find very meaningful as we think about today. Our promise for today's conversation is we're really going to dive right in to just learn a little bit in terms of what Banner Health is doing with their wellness and nursing program. That I think will provide the context for us that will lead into a conversation with Marla Weston and Carissa around the role of coaching and well-being and the effect it has on our teams. And then we'll conclude with some of the key requirements that organizations might consider as they think about really supporting their nursing workforce. By way of introduction, some of you may be familiar with Practicing Excellence, others may be new to who we are and what we do. We are a coaching and development company, and we have a very firm belief that an organization's success is ultimately going to be determined by its people. And it's our job within healthcare to really think through how do we coach and develop the workforce so that they can take on any of the prevailing challenges across healthcare. We are really blessed and grateful for the partners we work with. We work with about 40 health systems across the country today, coaching and developing tens of thousands of their teams. You know, at the end of the day, as we think about the nursing workforce, you know, we develop nurses on topics that matter. And we'll talk a lot about today about the opportunities at hand. But what we know is that the workforce today is struggling to connect the dots on so many important topics. And we've created a tool and resource and an organization committed to really helping the nursing workforce get better, feel better, and lead better on topics that matter to them in 5 minutes per week. And we use that doing video-based coaching tips that are all leverage micro-learning developed by nurses and for nurses delivered to them at a time when they need it most. And the cool thing is as you'll learn a little bit more about who we are and the work we do, is we figure out a way to actually drive organizational outcomes. And with the organizations who we work with, we were really lucky to understand and we've come to understand that coaching and development really is a win-win, especially as we think about the ecosystem today. Here's what we know. The first thing is that leaders are looking for scalable tools and resources to meaningfully support their teams. It's very hard to get to everyone and align the organization around what matters most. And so we are here to support organizations in that capacity. The second piece of it is your teams are looking for resources to get better, feel better, and lead better. And so our ability to connect those dots and really drive organization-wide change and improvement to support the well-being, enhance patient connection, team collaboration, and leadership effectiveness is ultimately what's going to help our healthcare workforce thrive. And so before I hand it over and introduce our colleagues and co-facilitators here, I do have 2 polls for you all. Again, these are all anonymous. So Matt, why don't we go ahead and put the first poll? We want to better understand your well-being strategy. And more specifically is how integrated is your well-being strategy into the daily work, right? And we understand folks are at different parts of the journey. Some are just getting started. Others are further advanced, but let us know what you all think. We're going to leave this open here for just a couple of seconds here. All right. All right, we've got some really well integrated, adequately integrated, but the balance really hinges on poorly integrated and not integrated at all. Okay, that's super enlightening. Again, we're going to share these responses here, and we're going to talk about integration. Integration of well-being as a strategic imperative to drive meaningful support for our nursing workforce, but also align priorities to drive change for the healthcare system and enterprise. One more poll before we dive in here. Matt, if you would. Does your well-being program go beyond self-care? This one's super easy. It's either a yes, no, and you're like, maybe, somewhat. All right, what do we have here for our responses? Okay, we've got 22% yes, firm yes. We've got 37% in the gray zone, and a solid 41% of folks are not integrating well-being beyond just self-care. And we're going to talk a little bit about that. I'd love to introduce 2 of my friends and colleagues who have graciously agreed to participate in today's conversation. The first is Carissa Bamford. Carissa has been with Banner Health for, gosh, I think you told me over 18 years, but really leading a team across the organization focused on how do we support, coach, and develop the clinician workforce at Banner Health. And she's going to talk a little bit today about their wellness and nursing program, which is really a comprehensive approach to align organization priority with the well-being of their teams. And then I'm joined by a friend and colleague, Marla Weston. Marla has spent 42 years as a nurse. We talked about this morning, and she brings a perspective of the bedside to the boardroom. Marla is a former chief executive officer of the American Nursing Association, and serves as a senior advisor for the Nursing Experience Project, really helping us guide how do we develop the right resources to support the nursing workforce at the right time. So welcome, Marla, welcome, Carissa. I'm going to hand it over to Carissa right now. As Carissa walks through an overview of Banner Health and the Wellness and Nursing Program, I would really encourage you to think about specific questions or topics that you want to draw up as we get into the discussion and roundtable aspect of this in about 20 minutes or so. So with that being said, I'll pass it over to you, Carissa.
Thanks, Gidon. Appreciate the warm welcome, and it's a pleasure to be here and get to share a little bit about our journey here at Banner and how we're really working to support our nurses based off of a strategy that we were already using to support our physicians. So pleased to be here. Just quick to set the stage for you guys. in case you don't know who Banner is or kind of what we do, we really are an integrated healthcare system, supporting all sorts of stuff from an insurance division to hospitals, clinics, labs, walk-in imaging centers. And last year we had over 9 million patient encounters. So we're spread out across numerous different states across all of the nation. And so we've got a lot of different communities that we serve as well. So enough about Banner, really just wanted to set the stage so you could kind of understand where we're coming from, because along those lines, we have over 600 nursing leaders, over 11,000 bedside nurses, and over 15,000 nurses that work for Banner. And so what I want to share next with you is a little bit about a story when we think about supporting all of those nurses who need to support those over 9 million patient encounters that I was talking about last year. Is we had to look around a little bit to say, is there anybody that's doing it right? And is there any lessons that we can learn from other industries? And this represents a story that we have learned actually from our own US military. And it's been documented numerous times. And most recently, there was an article published actually back in the late 1989, I believe it was. Every time we bring our troops back from whether it's a war or some place that they go through a traumatic event, there are two ways that our military send home our troops, and one is on the boat and one is on a plane. And as you can imagine, if you're standing in line to get on one of these and you've spent time away from your family and your friends and the normal, everybody wants to jump on that plane because you can get home tonight. You can leave this morning and you can get home tonight. And everybody that has to get on that boat, it might be a week or a month before they're able to come home and resume their normal life. And I feel like that's kind of where we're at right now, as we're trying to kind of pick our heads up post-COVID, post-pandemic. I couldn't even probably say that it's post, right? It's still here, it's not going anywhere, but I know we're trying to resume some bit of normalcy. And I think everybody's ready to jump on that plane because we're tired of what we've been surrounded in for the last 3 years. So with the military, one thing that they learned was they looked at the two different ways that they'd send these troops home, and they did an analysis of mental and behavioral health, as well as suicide rates, PTSD, even divorce rates, and was trying to see, is there a difference in those different populations? And what they saw was those that went home on the plane experienced much higher rates of mental distress, PTSD, suicide, divorce than those that went home on the boat. And what they learned was that those that went home on the boat took some time, intentional time, to debrief with the people who have walked in their shoes, talked about their experiences, and really, again, worked holistically to think about overcoming what they've been through. So with that approach, Banner said, all right, how are we going to think about building the boat? And that's kind of been my mantra. If anybody has met me lately, I think I've been saying that for the last couple of years, is how are we going to build the boat? And so the next slide really speaks to stuff that you guys all know about post-pandemic. With nursing, the turnover and burnout rates are at an all-time high across the nation. And really, if you think about what an imperative time it is to really think about how do we focus on supporting our nurses, there's no better time. And we know that there's direct relationship between engagement and safety and turnover and recommending, where you work to burnout. So really, if we focus on a holistic approach, we're really hoping that we're able to fight all of these things that we're seeing on this slide. I want to draw your attention really quick to the bottom left quadrant around recovery. And you're going to hear me say it probably more than once today, But we've got to be realistic with ourselves, and we have to know that recovery from the pandemic is going to take time, and changing a culture takes time. A lot of literature and research says that post-traumatic events, we see this from 9/11, we see it from war, we see it from bombings, that it's 2+ years before people are really kind of back on a normal path again. So just calling that out, one of the things that we did was we said, again, how are we building the boat? So the next slide represents a little bit of how we tried to build a bold vision. And we went and we dug and we dug and we dug through all of our nursing data, years worth of data, quite frankly, not just what we saw during the pandemic, but pre-pandemic, during the pandemic. And as we were kind of coming out to say, what is it that our nurses are telling us that matter most to them? We looked at engagement data, we looked at burnout data, we looked at safety survey data, we looked at Indie and QI data, and we sat. And you guys, this is the hardest thing probably for all of us to do, but we listened. We listened to nurses, we talked to them, we asked them big, powerful questions about the desired state that they really wanted, and a state that they were really able to be who they wanted to be. So the next few bullets, I'll read them out loud to you, but this is really what we came up with. So our bold vision is that we want Banner to be a bright spot of hope for what is possible when nurses are living their purpose. So purpose is important. Banner is a place where our nurses thrive and co-create a culture of health and healing. Nurses at Banner are a part of a vibrant community where they live their best lives, participate in inspired collaboration and empowered exploration, and achieve professional and personal fulfillment. And there's this concept of magical, memorable moments. We know that our nurses and our clinicians deserve to live their best day in medicine over and over again. And this is our commitment to that. And then really, when we think about creating this environment or culture, it creates highly engaged nurses who now more than ever, when we think of, everyone hears about the Great Resignation, but it's not just about keeping people, it's how do we even attract people and create a culture and a space where people say, yes, I want to work there, and they're telling their friends. So we threw this out to our board and we said, what would be possible if we could actually create this bold vision? So next we said, all right, we've got to think about what's the strategy that we're going to intentionally choose. And we actually went through a lot of different models around well-being. We knew we wanted it to be holistic. We knew that it needed to be evidence-based. And we needed some proof that it worked. So we went back to what we were actually using for our physicians, which is our Swinson model. And it is a 6 elements evidence-based model that really does put together a holistic approach. A lot of you guys in the chat, as I was looking, mentioned things like balance, health, you mentioned culture, you mentioned resilience. I know I saw rest, empathy, respect. All of those things fit within these 6 elements. So just quickly, just to kind of level set what each one of these are, design really means designing organizational systems that address human needs and allow people that are to set things up for success. Our policies and our procedures are designed in a way that our nurses can be successful. Again, systems and infrastructures are set up that in a way that allows people to be successful and truly operate at the top of their license. The next one, it kind of goes out of order on here, but we've got leaders on here, and leaders, you guys know this, but everybody deserves to have an amazing leader. And we don't always equip our leaders to really be able to lead their teams to the best of their abilities. So that one really is around a lot of leadership development, which you'll hear us talk a little bit more about here in a minute. And then we've got social community. There's a lot of research that talks about how important social community and the power of belonging is to a person's well-being. When you're able to gather with people outside of just talking about a patient chart or a particular case, it really does create a space to get towards that desired cultural state that we're trying for. And I'm reminded of this day in and day out now, that it's harder probably than ever, and we have to be more intentional to have social community. I think we used to easily have kind of the water cooler talks, or you'd walk down the street. We were talking this morning about walking down and having lunch together in a certain place, and now people are in different locations. Some people are virtual. So I think we have to be really intentional with this one. The other one is individual wellness. And this is what everybody thinks of, right? This is your diet, your sleep habits, your exercise routines, etc. It's important, but again, it's one piece. And then the other one is our second victims. We live in healthcare, we're clinicians, and we know that things are not always going to go right, and we are going to have bad outcomes. The most important thing is, how are we going to support our nurses during and after those bad outcomes, or if we have any sort of event, how are we going to support them through it? And then the last one are pebbles. And this is probably the biggest elephant in the room. I think so many times people want to glance over sort of those operational inefficiencies that get in people's way of operating at the top of their license and doing the things that really they should be doing to care for their patients. And so this is something that, again, organizationally, we really have to look at how easy do we make it to practice medicine and work at the bedside. So that's just a little bit about our strategy. So I told you we're thinking, okay, we got to build the boat. Now, what's our strategy going to be? Next was, how are we going to move really quick? Because we don't have any time to waste. So we really started thinking about, how can we move quickly? Do we have any existing partners that we might be able to leverage? And the first one, honestly, that came to mind were our friends at Practicing Excellence. We have been utilizing the Clinician Experience Project for the last 3 years, and we know it works. We know that our physicians and APPs engage in it every day. And we said, man, could we move quick with a strategic partnership in the nursing space with this? And the things that really attracted us to think about putting together this type of learning and development and coaching for our nurses were the 4 bullet points that you're seeing here. So it's important that we think about, does it support our organizational vision and strategy? Can we create alignment and synergy? Because you heard earlier that really well-being and the culture that we're trying to get to is something that really has to be interwoven into the organizational fabric. And you can't do that if you're not really intentional around the synergies that might, present themselves. So the next one here are tools and resources. My favorite kind of analogy that I use here is, you guys probably all feel it yourselves. You've watched your nurse leaders and your organizations carry around a Thanksgiving platter full of expectations and things that they need to do with deadlines and getting things turned in and tasks to complete. And honestly, there's more of those than there are time in the day. So prioritizing your priorities are important, but also giving them the tools to be successful at whatever those expectations are. And we know that this NEP and the Nursing Experience Project was one way that it will allow us to give our leaders tools to meet those expectations. And then there's nothing better than thinking about doing something together. And when we thought of sustainment, that was something that was important to us with this particular program. Was we wanted to do it together. We wanted to be able to prescribe the content and push it at the right times, that we weren't overwhelming people, but it was directed and we could control that. We were wanting people to improve together. And then we love the concept of learn, try, and then share. So you're learning something new. It's actionable within 5 minutes. You get to try it. You can try it out that same day. And then it's really easy to talk about and share with a colleague after. So that was the main 4 things that we looked at. And there were 3 main areas of focus that the next slide really presents and shows us. We started out thinking about our nurses told us when we were talking to them and looking through the data that personal development is important to them. Now, granted, they don't have all day to go sit through a training or a conference, but if they could uptake development in bite-sized chunks and it was scalable and their peers could do it with them, that was something our nurses told us, yes, we want that. We know that leadership is important. You saw that on our WIN 6-dimensional strategy. And I don't know about you guys, but we have probably more new nurse leaders than ever before. And I think we sometimes do them a little bit of an injustice where we think, man, they were a really amazing bedside nurse. And, they had great influential skills and their peers look up to them. But that doesn't always equate to being a really great leader. And we put them in leadership positions that, again, don't allow them to be successful. So this was really a way that we could develop a track or a journey to take our nursing leaders through, from bedside nurse to first-time leader, peer to boss concept, all the way up into an executive level leader. And then the other one is system and service line priorities. We know that we, just like you, are probably driving, annual initiatives and priorities by your service lines or business lines or your hospital. And those are things that are important to us because, again, we're able to say, this isn't just another thing, but look, here's a tool or a resource that helps you accomplish these things in front of you. So a couple additional benefits that our nurses tell us over and over again that they love about NEP is that it's really easy to access. It's on their phone. You can watch the video or you can listen. So many people are listening on their drive to work. Or one of my friends says, I listen every morning while I iron. And there's just a lot of ability from an access perspective. We knew it needed to be, again, bite-sized learning and just one thing at a time. When you give people too many things to try or too many things to work on, it becomes overwhelming and it even creates resentment. Also, I love that we're working to get the CEU credits available for our nurses because that is a huge driver, especially when we're thinking about time that they don't have. Short build time so we can implement really quickly. The other thing that our team is really committed to is we do as many things as we can for nurses or by nurses for nurses. And really, we know that gets us instant credibility. And there's nothing better when you're able to hear from or learn from somebody that's walked in your shoes and has some of those same experiences, just like those who are debriefing and spending time together on the boat. And again, we know that we've got a great partnership with Practicing Excellence already. So it's amazing how we're able to say, hey, here's a gap that we're seeing. How can you guys help us drive maybe some strategy around that or a tool that will help kind of fill that gap? Something else I want to point out really quick here is that there's a lot of content, and sometimes it's overwhelming because there is so much content to know, again, what do you prioritize to look at within the nursing experience project. So you heard me say, we're trying to be really strategic and intentional around those 3 categories on that one slide. But we also really look at how are we creating development and providing this to our leaders based on all 6 elements of our WIN strategy. So I mentioned, sometimes pebbles is the elephant in the room and no one wants to talk about the stuff that's not working or the inefficiencies or the process improvements that need to be made. There's tips and tricks just within this app, 5 minutes or less to help you with some of those kind of things. So it's really tangible. And then next, I think everybody's probably asking and thinking to themselves, all right, so how do you start thinking about success metrics? Because really, if you think of the business case that you're looking to put together, it's important. Again, I mentioned to you earlier that none of this happens overnight. And we really have to think about the things that we're going to commit to and how are we going to commit to them for the long term. So for us, we're committing to our WIN strategy, and we're committed to using Nursing Experience Project to help us with that strategy. So we've got 2 measures that we're looking at. So we look at process versus outcome measures. So in the beginning, we look at process measures, and those are the things that you're really saying, okay, what's the uptake look like, right? How many people are engaging in this? How many people are getting outside the prescriptive program that we sent them and they're actually looking at the app, not just the stuff that's being pushed at them, but they're saying, hey, I have a gap here, or I have to have a difficult conversation this afternoon and I've never really done that before because I'm a brand new leader. Is there a tip that will support me with that? So these are the types of numbers that we looked at first for our process measures. And again, just to call your attention, we've been on this journey with our Foundations of Nursing Leadership program. So for every nurse at Banner is going through this program at the same time to really level set our leadership model. And I mentioned that we had a little over 600 nursing leaders at Banner. And so you can see that actually our users and those that are engaged in this platform, greater than 90%. And just so you guys know, this isn't something that's mandatory, and it's not something that's tied to compensation. These are people saying, this actually is helping me, and so I'm doing it. And then you can see total tips watched, great, about 20 per person. How many people are going outside of the, again, that prescriptive content. So 479 tips that people are looking at and uptaking to those things, like I mentioned before. And then I always say one of the greatest measurements is, okay, they're doing that, but are they spreading it, right? So if you think about really trying to create cultural change, it's one thing just to uptake what's being prescribed to you, but are you sharing it with others? And so far we've had 244 tips shared to other people who weren't looking at some of those same ones. So people talking about what is it that they're watching and sending it to a friend. I just actually did this yesterday to our chief medical officer in the organization. We were talking about compassion, and I had just watched one of the videos, and I said, oh my gosh, Dr. Bessel, check this one out. I just watched it and was able to send it to her like immediately, which is always really amazing to feel like you've got some kind of tool or resource at your fingertips. The next slide kind of gets us into some of those qualitative measures, because I think, again, we're going to talk about numbers here in a minute, kind of that quantitative and the outcome measures that we're going to be looking for. But the qualitative is, what are the stories that we're hearing? What's the language? What's the testimonies? And I have never seen, honestly, you guys, anything like this where people will watch a video and the deep thought-provoking comments that they leave after they watch a video is, it's pretty cool. A lot of conversation that happens back and forth on the platform about sharing best practices and maybe a key learning that they grabbed from a particular video. So I want you guys to all be able to see this really quick here. And I'm thinking, I want to share a quick story here, because I've actually been working with a nurse leader for probably the last year as we were starting this work. He was kind of newer to his role. And as we were rolling out Nursing Experience Project, I could tell he was somebody that typically is engaged, but he was really looking at it to say, man, I feel like this is just another thing, and I'm not sure that I have time for it. I mean, he actually said, I'll give it a fair shake, and I promise I'll try it for a couple months. And I was actually just talking to him last week, and he says, I am converted. I am a firm believer. I'm an evangelist of NEP, because truly it does feel like it provides me with the skills that I didn't even know I was missing. And if there's anything that I'm, having a question about, he says, I literally go in there and I can find anything, and I can spend 5 minutes and prep myself for whether it's a conversation or a project I'm about to start on. And it gives me that extra boost. And so again, he keeps saying, it's my coach in the pocket. It's my coach in my pocket. So just a fun way to realize sometimes it's hard, and sometimes things you think they're going to be an extra, but they're not. So we're just getting ready. I have to tell you guys, we're just getting ready to start our annual survey process, where we measure engagement and leadership effectiveness scores, and we measure burnout, and we measure our safety scores. And so here, the first part of September, we should have a lot of really great outcome measures that we've been just anxiously awaiting for, but I really do envision some good change. And I think, again, knowing the environment that we're in, being able to sustain ourselves and get better is better now than ever. So with that, I think I'm almost done. I know we've talked about looking kind of through the chat. I don't know, Gidon, do you?
Yeah, well, first, thank you for sharing this story. As I listened to this, and obviously I've heard this before, I've lived some of this, but it's just astounding to me, sort of the bold nature of this from Banner Health, right? I think most organizations have realized sort of the current state and are trying to think innovatively. And there are a lot of competing priorities, quite frankly, and that you all have sort of been bold and gone, you're pioneering. And so congratulations to you and the organization. We do want to just jump into a Q&A and discussion. And our hope here is that, this is really driven by the folks on the line. And so again, I'll invite you to submit specific questions you have to Marla or Carissa via the QA function. While you all drum up your questions, Marla, I've got a question for you just to kick off the discussion. You've done a lot of work in the well-being space. You've written about it so many different places. What's your read on this, and how does this compare the wellness nursing program with other things you've seen throughout the industry?
Yeah, great question. Well, one of the things that I'll just start with is every organization that I know has employee well-being, nurse well-being in their strategic plan. They didn't necessarily 2 years ago, and everybody has it now. So it is a strategic priority, and we're trying to figure this out. What's been challenging for people is that they've invested a lot of time and energy in developing very robust programs that kind of sit over on the side, and they're grossly underutilized. And people are very frustrated that this needed resource is not utilized. So there's, I think, two things that I see that Banner did that really were very wise that other organizations can adopt. One was to think about it in this strategic and holistic way. Nurses don't need well-being programs shoved at them. They need well-being programs surrounding them. And that whole holistic approach, I think, was really key. I can talk about that a little bit more. And then the second strategy was really thinking about how to have this land in the lap of the nurse in a way that was easy and adaptable and just infused into their everyday life. And that's where I think the app focused micro learning videos was so valuable. Part of it was it lands in the lap of the nurse, but simultaneously every nurse in the organization can be getting the same learning at the same time. And so you've created now this culture of learning where you're not on your own. You're not trying something and nobody else knows what you're talking about, but everybody in the organization gets the same information at the same time.
Great. Again, I'd encourage you guys, if there are any questions from the audience, feel free to put them in the chat or the QA, and we'll definitely try to address them. Chris, a question for you. Obviously, finances are a big topic within and across healthcare today. And I'm curious, obviously, you've got a very robust program here engaging, I think you all have about 18,000 nurses across Banner Health. Can you talk to us a little bit about the nursing strategic plan, where this landed, and how you all are funding this for the organization?
Yeah, it's a really good question, and probably something that everybody is like, yes, how do we pay for things like this? Whether it's, a strategy that involves, a multi-dimension approach or one particular tool. And I'll tell you, there's a couple ways that we've been able to do this. So one thing is, quite frankly, I do have a team, and our team has shuffled a little bit in the last kind of 6 months, but there's about 10 people throughout Banner who are solely working on WIN, which is Wellness and Nursing, and CHIM, which is our sister program for our clinicians with our physicians and APPs. And so we did have the commitment from a people perspective to work on that. But the other thing is now more than ever, our communities from a philanthropy perspective are looking at how do we help our caregivers, and how do we make sure that we're going to be able to provide exceptional health care to everyone in a community. And I would say that the time is really ripe for a lot of those particular donors from a philanthropy perspective. So a lot of the money actually that we get for specific tools and programs that we do is through that exact thing. We're building things into our operational budget as we go, but to really get us started, it really was a commitment from our foundation and those folks across the community really wanting to make sure that we were supporting our healthcare providers.
Yeah, and I'll just add to that, there's two parts of resources that you have to think about. One is the financial cost of any program that you put in place. And the second is the cost to the staff to implement it, right? So we've already talked about what's kind of beautiful about this is it's 5 minutes a week, micro learning. But I often get asked about what about the nurse managers? As Carissa already said, they're carrying around these Thanksgiving platters that are already overloaded with stuff flowing out the sides of them. And I think people have to think about how any program that they implement fits within the organizational structure of what you have managers already doing. And what you need to think about with all of your well-being programs is how do you build it into the activities that you already have in place? How does it work inside the huddles that you're already doing on a daily basis? How do the nurse managers talk about these things in their monthly nurse manager meetings? How do you infuse this into change a shift? And once again, part of what's nice is having some sort of tool like this app that everybody's watching the same thing. So it generates this conversation where you don't have different leaders in different departments talking about different things, but you're creating this amplification that really rolls out in a very powerful way. That's part of thinking about this strategically, right? How do you make change over time? And it's getting everybody in alignment, doing the same things, thinking about the same things in the same time.
Yeah, and what's standing out to me when you both describe what this is not about watching videos, right? You've both described the effectiveness of integrating this into an organization so it becomes part of the DNA and leveraging what we know as adult learning theory of trying, right? The process of learn, try, share in the application and the magic that happens when you learn something new and you build that muscle over time, right? And so we've heard so many stories where whether you're trying to connect to a colleague or a patient or be a more effective leader, first of all, you need to learn the skill and then you need to refine the application of it over time. And the real magic happens when you've got your other colleagues and teammates doing the same thing. And that is not going to watch a video. That is really defining who we are as individuals, as teams, as an organization to drive towards that better, right? And so we do have a couple questions around from Michelle and Maeve, just the pricing around this, just so you guys know. We could take that offline. It is based off sort of volume and number of folks within an organization. I think what's important to note is that access to the on-demand resources, you have access to everything. Okay, so again, more importantly, it's how do we align to your organization's strategic plan and the work that's already being done to use this as a booster to accelerate the support of your teams and the outcomes that you all are seeking.
Gidon, I'd like to chime in just really quick
Sure.
on that while we wait for a couple other questions to come in, because I want to give you some clear examples. I mean, Marla, yours were great. Like, how do you build it into a huddle or a staff meeting? And some other ways that we've been integrating this, because that is the most important thing, is integrating into regular operational workflow and using this as something that allows, again, our leaders and nurses to achieve the expectations that are in front of them. So a couple things that we've done in the last 9 months is build this into as a tool to use for our annual initiatives and our long-term initiatives. So as we're working to hit certain metrics, we're using this to drive. So we're saying, here's the content that will help you achieve these metrics. Just like you would with patient experience, right? You're trying to hit a certain target or a metric. Here's the content that you need to hit this. And that's been helpful. And then another thing is we do basically an assessment. So everybody does kind of an annual review of their employees. At Banner, we do it a couple times a year, and it follows a process where we ask people, what are your career aspirations? What is it that you want out of your work in your career? And how do you, what's the journey that you want to go on? And then we talk about what are the results that you've been getting? And then what is your challenge to grow? So that challenge to grow is something that's done in partnership with the leader and the nurse to say, all right, you told me what your aspirations are. Now here's here's a plan that we can put in front of you to help you get there. And over, we've been able to use this to help create that challenge to grow. So if somebody says, I want to get better at process improvement, or I want to practice some leadership skills, and I want to lead a particular, you know, a little group or a side, you know, committee or something, it gives them the tools to do exactly that as well. So those are just two examples that are easy.
Okay, awesome. Marla, there was a lot of chatter at the onset around work-life balance and sort of the premise of work-life balance and well-being. And I know you've written extensively about this. I'd be curious just to get your take on the topic and some of the things you're seeing nationally.
Yeah, well, you know, one of the things that I've been thinking a lot about is we talk about work-life balance, which we know is crucial to all of our well-being. And we tend to concentrate on what I call the balance side of it. What we don't pay as much attention to is the work side of it. And how do we make work better, easier, more meaningful? We all work, and particularly we as nurses go to work to make a meaningful difference in people's lives. And so part of what is so powerful about the approach that Banner used and some of the resources inside of the Nursing Experience Project is that it concentrates as equally on the work side of things. How do you make work interesting, robust, meaningful, impactful? How do you get to go to work and be the best nurse that you want to be? And so there are a lot of tips and resources on that side of things, because that's the place, frankly, that we as employers of nurses have the most leverage, is how do we make work meaningful for people?
Marla, there's a question from the audience around providing an example of what a 5-minute session might look like. Is there, tell us a little bit about what your favorite tip, bring it to life for us.
Well, you know, one of my favorite tips is about accountability on the part of the nurse. And it starts with a story about a patient who is short of breath and thinks that a physician is needed. And the nurses do all of their nursing care in taking care of this patient and solve the problem. And the tip then goes on to describe what accountability means. You know, certainly nurses would have called a physician if they needed a physician, but in this case, there were many other resources that they were able to implement based upon their nursing expertise. And then it talks about understanding your role as a nurse, what you're accountable for, and how to maximize your contribution. And it ends with what we call a try this challenge. Every video ends with a try this challenge, which is a way of putting what you've learned into practice today or this week. And the try this challenge is watch for the things that you and your colleagues do independent of any other practitioner and the difference that you make in patients' lives. And so it's a really powerful way of getting nurses back in touch with their practice and the difference that they make.
Yeah, just it's really important. I think some of the things you wedged in there, which is important, is sort of the anatomy of a tip. For folks who may not be familiar with micro learning, all of our content is 5 minutes or less. That's our commitment to the learner. And within that 5-minute vignette, we are going to teach you something, right? And there's always that hook that Marla described, and that's a story or the evidence that supports it. Then there's going to be a challenge, right? It's going to tell you in your next interaction with a colleague or a patient, try this. And there's always going to be that try this challenge, right? The call to action. You know, one of my favorite tips is really about how do you build rapport? And it's a simple question you might ask. And I've actually used it with our own team. It's what about this worries you the most, right? And being able to ask that question and sit back and simply listen and build those listening skills. And so these are oftentimes things that have never been taught. And it's many times not rocket science, but it's just no one's ever taken the opportunity to really put it in the context to help us build skills over time on topics that matter. And I think that's what we're driven to try to support and coach and develop our teams on. There's a lot of...
Well, I'm going to jump in and answer one question, because one question that I see is, how do new nurses get caught up a year after everyone has gone through it? And one of the things that we're working on right now is an onboarding program, particularly aimed at new graduate nurses. And it's going to be a year-long program that summarizes all of the content that might be included in other programming in order to support people as they are onboarded, as they go through orientation. And then they would land in whatever other program other nurses are going through. I should also mention that some of the programs are really aimed at a subset of nurses. So Carissa talked about having some content that is really focused on nurse managers. We're also looking at developing some content right now for preceptors in particular, to develop their competence and skills and make the experience of being a preceptor enjoyable. You know, one of the things we haven't mentioned yet, and one of the things that really attracted me to this work, was that this is called the Nursing Experience Project. It isn't about patient experience. It isn't about productivity. It is about the experience of the nurse. Because I think we all know, and I firmly believe, that when you get the experience of the nurse just right, everything else flows from that. And so this content is both educational, but also inspirational to reconnect people to the meaning and the why of their work.
Awesome. I've got 5 minutes before we have to move on. And so I've got two questions, and I'll let you guys decide how you want to answer them. The first is, obviously the nursing workforce is really tired right now. And Carissa, you had mentioned the Thanksgiving platter. And so amongst competing priorities, how do leaders fit in coaching and development, you know, as a strategic priority? You know, nurses try, I can't make this mandatory. Tell us a little bit about what you're doing, Carissa or Marla, what you're seeing, and how this might actually accelerate some of the other strategies underway.
Yeah, so when I think about helping them prioritize their priorities, right? And let's give them a dinner plate instead of a platter to carry around, if at all possible. So what we've been able to do is, as part of our strategy with WIN, is to actually say, what are going to be the most important things that we are going to ask our leaders to focus on? And we're going to give them the tools and resources to be successful with those things. So we actually did do a little bit of a time study and say, all right, everyone, we're asking them to do 48 hours worth of stuff in a 24-hour day. What's coming off, right? So we did really have to look at that and get very strategic. And that's tough. That's tough for anybody to do, and then figure out, where does stuff go? Can it go somewhere else? But again, most importantly, as it relates to NEP, was after we narrowed our list and we had the dinner plate, then we said, okay, what are the tools and resources that are going to support those very specific things? And we actually last year brought all of our nursing leaders to an on-site summit, and we went through the exercise and practice of, here are your prioritized priorities, and here's how you use NEP to help you with some of those kinds of things. Gidon, one thing I didn't mention, and I'm just seeing that maybe in the chat there's a little bit of maybe confusion, or just something I want to shore up a little bit, is that
Sure.
We were really intentional around starting with our leaders. So again, we've been on this journey for only 9 months, and we are just now really getting it down into the front lines. We really believe that in order to create this desired cultural state, we had to have leaders that were bought in and role modeling these things. And so, you know, as that occurs, we're going to be getting a lot more measurements within our patient experience scores and turnover rates, et cetera. And those are the ones, again, I mentioned we're all chomping at the bit to get. But I think it's important that everybody realizes, again, as we look for the numbers to come in, it is a process that takes time. So what are you going to commit to from a process measure perspective, right? The engagement of a tool before you're going to see the outcome measures of those results.
Awesome. So as we finish up, what one piece of advice would you share from what you've learned in this work? And I'll pose that question to both of you. Marla, you want to go first?
Yeah, I'll go first. You know, I think what I would say to people about well-being is I'd reiterate Carissa's point of this is a journey. We're all learning, and it is important to start where you can start. And as you think about this, how to have it not be a thing that is layered on top of everything else, but infused into the new way that we are all doing our work.
Great. Carissa?
Yeah, I would say, so ditto to Marla. And then I would probably just add, it is so important to listen. And I think all the time we're asking our nurses, again, what matters most to them? Why are they in the profession anyways? We're constantly, I mean, I don't know about all organizations, but at least for us, we're constantly, you know, surveying and asking these big questions, and they tell us and they tell us and they tell us. I think the worst thing you can do is keep asking and do nothing. And so I feel like this is us really saying, we heard you and we're committed to doing something.
Awesome. Well, I'd like to thank you guys. You know, in summary, some of the key requirements to coaching, you know, with Practicing Excellence, we dedicate ourselves to supporting organizations like yours to coach and develop your people, right? And I think one thing we've noticed is, you know, coaching must align to a strategic plan with a desired destination or outcome. You know, if you're going to engage folks, the content has to be relevant, short, and actionable. It's got to be accessible for folks, right? It's got to meet them where they're at. The unification process of going together is much better than going alone. It builds esprit de corps, enhances camaraderie, and helps us drive towards outcomes. And it's a real opportunity to celebrate, right? Celebrate accomplishment, celebrate learning, and celebrate getting to better. You know, we at Practicing Excellence, you know, this is what we do every day. And I think as leaders in healthcare today, you have to connect the dots. And so we talked about wellness and nursing, but we know there are other strategic priorities out there as well. And so how do we connect those dots to get the right content to the right people at the right time? And how do we do that in a way that leverages the best of adult learning theory and technology to make sure we've got alignment and are able to actually execute, to actually give people resources to get better, to feel better, and to ultimately lead better. And that's really our mission and our charge. You know, as we think about the nursing workforce, we too are early on this journey. I think Carissa said that a couple of times. We're about a year in. We've made a commitment to growing a community all focused on supporting the nursing workforce. And we're grateful for our early partners who've made that commitment to journey with us. You know, one of our core values here at Practicing Excellence is really being outside in. And what that means is we listen to understand what the needs are of our partners and then go create to solve specific problems. And as our community grows, as that voice grows, as those opportunities are identified, we will continue to build those solutions, to test those solutions, to measure those solutions, and to publish on those solutions. So lots of questions around outcomes. We will get there. We are not there yet. We have tons of confidence in the work that we do, having published in the National Journal of Quality with Northwell Health and having about 10 other case studies demonstrating the efficacy of this work, that we are on the right track. We will then prove that out for the nursing workforce here soon. So I'd like to extend a warm, heartfelt thank you to Carissa and to Marla for your time today, your insights today, for your bravery of being bold, not just within the context of the last hour, but the work that you all lead every day. This is hard work, and your passion and commitment is certainly making a dent. So thank you all from me and also the team of Practicing Excellence, we truly feel grateful for the opportunity to be with you on this journey. For those of you who carved out some time to be with us, we've got some resources that we're going to share with you. To learn more about the Nursing Experience Project, please feel free to visit us at practicingexcellence.com. We're going to send you a recording tomorrow, and then next week we'll actually include a summary of the conversation. I know many of you have colleagues who weren't able to join us today, and we want to spread the word and make sure that you're able to share that with those colleagues as well. So again, thank you all for joining us. We'll answer all the questions that we weren't able to get to and follow up directly, but thank you for your time, and thank you for the work that y'all are leading on the front lines.